Your Health 360.
Good evening, everyone, and welcome to the program Your Health 360. Without waste of time, we're going to be continuing what we were talking about last week. And of course, for those who remember, you know that we had with us Dr. Abrak. He was the one that was here with us, and we talked about medications and what we should know. I got a lot of feedback last week. A lot of people were really happy. They talked about the fact that there were questions that they got answered, and there were also some gray areas still, which is why we're continuing with that vein today, talking about what we should know when taking medication. But first and foremost, allow me to welcome Dr. Abrak into the studio. Dr. Abrak, you're welcome back.
Thank you very much, Ma.
Great to have you here. Now, quickly, Dr. Abrak, let's just jump into it. Some of the questions I got last week, and I'm going to start with when they say take medicine.
Okay.
Some of us take it with what we call soft drinks or minerals. Some of us take it with juice. Some of us, in fact, put it inside tuwo, because if the medicine is bitter, we put it inside tuwo.
Yeah.
Is this good? Does it affect the efficacy of these drugs that we take like this?
Okay. Thank you very much for inviting me over again for another time to talk about our health. And this topic is interesting because it's what happened commonly in our homes. And mostly we don't get guidance concerning how to take our drugs or what we should use to take our drugs with. I pray to get better terms to explain to a layman why we should take our drugs with a desired liquid, or means there are those that are powdered, there are some that are as advised that you chew. There are those that are advised you should take with water. So those ones have reasons. Just the same way when you put in a powder into oil, it doesn't mix up easily. So imagine taking with a substance that is oilish. That drug is supposed to melt, dissolve, so that it can be absorbed easily. Imagine you taking it with tuwo like you just mentioned. Where is there enough water to dissolve something which is already a powder or stony hard? Just a question to ask yourself, or even to the listeners everywhere. So there are reasons why you should take with water. We said take with plenty water. If taking with water could be a problem, you can dissolve it outside. Then take it in the liquid form if you're worried about how it will pass through your throat. Dissolve it in the water, then take it. Because that the whole of that drug, remember last week we talked about each drug have to go through the liver, where it is either activated or it is broken into a simpler form, and the percentage of drug that will reach to where the action is needed will be reducing at each level. Remember, you took it from your mouth, through your mouth to the stomach. It is supposed to be dissolved. There are enzymes in your stomach that will start acting on that drug, either by destroying some part of it or by facilitating that drug to be dissolved. That drug will also be absorbed into the intestines. Not 100% of that tablet will be absorbed. Remember, some part of it will have to go through the fecal matter. Imagine 50% is absorbed into the circulation. Another 50%, that same 50% will go to the liver. In the liver, it has to be activated. We always believe that not all of it go through the activation process. So at each point in time, that drug is reduced. So if we need 2 milligram to give us what we need in the body, that drug may be formulated in 5 or in 6 milligram, because we anticipate that at each level, that drug strength is reduced. And you anticipate that you may get the 2 milligram at the end of all this process when you take with water. So if you take with tuwo or pete and it doesn't get dissolved all, imagine losing already 4 milligram because you've taken tuwo and it was not dissolved. It followed the fecal matter. Then you will have only 1 milligram absorbed. When it reaches the liver, so for some bypass metabolism, you may have only maybe half a milligram. This is someone who needs 2 milligram to reach an efficacious state. So taking it with an inappropriate substance is not advisable. There are always guides. And most of the drug that, especially for children, when you check, you see the directives. You should boil water, allow it to cool, then you mix it. And when you mix, at interval of time, shake it. So those instructions are there because you need a certain quantity to reach the target point. So there are advice. If it's a chewable drug, we now know that definitely if you swallow it solid, it may not undergo that dissolution very fast. So there is need to break it into a simpler form to fasten dissolution, then later absorption. So you may swallow it solid. It may reduce the effect or a quantity that may reach to the target point. So different drugs have different means of taking them. So it's advised, if you don't understand, ask your doctor before leaving so you can be guided. And if it means water, please take water for the benefit of why you're taking the drug, not for your satisfaction. You can sacrifice a day or two for the inconveniences and live another 20 years better. So if you look at it, 2 days of discomfort is worth giving it a trial than leisure. Sickness is not leisure. You have to fight through it and get out of it. But you have to follow instructions from those who actually have formulated the drug and those who have prescribed. Follow it duly so you can actually gain the benefit.
You know, Dr. Abrak, while you were speaking, I just thought back to the times when sometimes just because I didn't feel like chewing, I would take, antacids for stomach upset.
Yes.
I would just swallow them. And usually they say chew. I'm talking about the tablets now.
Yes.
But when you chew, there's a way it enters in between your teeth. It's very uncomfortable. So there are times when I have swallowed, and I can tell you that honestly, I did not get the desired result. And I was wondering that, but it all goes back into the tummy, and we're supposed to have enzymes that break down medicine in the tummy. So what's the big deal about chewing? But the way you explained it now just made more sense.
And one good thing about that drug you mentioned, the antacid, it comes in different formulation. We also have the liquid part that is a suspension. So if you don't feel comfortable with the chewing, go for the suspension. There is a reason why each of those is being prepared that way. And if the suspension doesn't work for you, then the chewable should. Otherwise, you may still have to bear or tolerate your stomach symptoms. Otherwise, it's better we adhere to instructions. Chewing is better. And you can take that as a home assignment. When you get the MMT, try to put it in water and observe it. Put another paracetamol in water, observe it. And then watch and see how long does it take for the paracetamol to dissolve into homogeneous mixture compared to that of the MMT tablet. So when you do that, you actually know that there is a reason why you should chew. Yeah.
Indeed. Small experiment to do there.
Yeah,
all right, so let's move on to the next one. And this is particularly about little children, because they are the ones that a lot of suspensions, liquid medicines, drugs are targeted at. Now, you see some drugs, especially these ones that you say should be reconstituted. You buy them in powder form, and then you are asked to use water that has been boiled and cooled. And then some people just say, okay, since it's just clean water you want me, to use in reconstituting this drug, I might as well just buy bottled water and use it. Is this right? And then moving further on this matter of reconstitution, is it proper to reconstitute those drugs or to mix those medicines for little children especially, and still keep them at room temperature if you don't have a refrigerator? Because many times you see medicines, they will say once reconstituted, please ensure that you put in a refrigerator. But there are people who don't have refrigerators. So 2 questions I've asked on this matter of mothers especially making drugs, mixing drugs for their children. In the first place, boiling and cooling water, is it the same as buying clean bottled water and using it to reconstitute and just, doing away with that process of boiling? And when you finish mixing it, is it okay to keep it outside the refrigerator, especially in situations where you don't have any?
Okay, for the first question about boiling water and buying clean water. For medical practitioners, there's a difference between what appears clean and what appears sterile. Sterile is free from germs, while clean is physical to the eye. Now, you may assume every water is clean because there are no particles. But what about the microorganism you can't see? That is the essence of boiling. You have to boil that water. When it starts boiling, you leave it for 15 minutes while boiling. Then you can keep it down to cool. At that state, we believe most of the germs could actually die off. It may not appear clean to your eye, but sterile to a medical practitioner. That's why it's advised to always boil. Now, concerning the water you buy, depends where that water is prepared. Has it gone through the boiling process, the filtration and others? Is it boiled? It could appear clean, but is it sterile, free of germs? So that you don't prepare something with normal water, because most of our pure water, sometimes when you held them up, you see particles. Some of them are just packaged, they are not boiled, they are not sterile. There's a way we prepare sterile water. Sterile water is undergo heating. The steam that goes up is collected through a tube that is called a condenser. Imagine the steam that left the pot in form of smoke is collected somewhere. That steam now cool off and is collected in another chamber that is now sterile water. By the time it keeps steaming, you come back and you come down and find out that the boiler have a lot of debris that is left behind because the water had been evaporated to be collected in another different chamber. That's a form of sterilization. So do all our water company go through that process to prepare your drug? I think I'd rather advise that if you're lucky that most of your preparations or most of the drugs you have already have the water content prepared inside, use it because it might have undergone the sterilization process. But if not, please boil your water. If you get a clean water, packaged bottle water, please boil it too, at least to some degree of sterility, so you can be able to take something clean. Drugs are meant to cure or to at least improve the quality of life, not to give us more disease. Because when you don't take it right, you come back to your doctor again. That drug didn't work. Oh, I've started taking that drug, but I have diarrhea. I have stomach upset. I have fever. Yet you're taking drug, but with other microorganisms. So that's my advice on that.
So what about the refrigeration aspect?
Yeah, drugs that are meant to be refrigerated, they also have reasons why you should refrigerate them because of the active state. Some of them will even have a marker on them, a sign that when it is warm, that marker will change color to tell you that that drug have lost its efficacy. Now, if that drug cannot be stored at home, then it should not be made in a larger quantity that you may have to use and reuse again, because not everyone will have the storage facility. Most of those drugs that need to be stored in refrigerator may have a short or small dose that need to be given either just as a start dose. You give once and it's over. Now, most of those drugs are stored by the cells or the pharmacists themselves because they actually know why this drug should be stored in this very temperature. But most of the drugs that are being given out, like over-the-counter drugs, they have less of those rules and regulations. So for a drug that need to be refrigerated, better get them daily from the source, or you have a refrigerator. If you don't have one, then there is no need buying such drug. Be in the hospital, like I said last week, there are some conditions you will need to be admitted, not because you are so sick that you need to be admitted, no, but because the regimen of those drugs, the regimen and the timing of those drug administration need to be given professionally and with timing. So if your drugs need refrigeration, please, you may need them to be in the hospital. Something like, let me just give an example, like diabetic patient. They need to give themselves insulin. We teach them how to give themselves insulin, and they need to store that drug in the refrigerator. If you take 10 international units of insulin and your blood sugar goes down to 4 or 5, you keep taking and you're not keeping them in the fridge. Over time, that insulin will change color, which is an indication that it has expired or is now invalid. If you keep taking the same dose of insulin or even increase, it will change nothing in your sugar and you still remain sick. Is inactive. So like most of those, we always advise you get a refrigerator, or at most, yeah, this disease condition, they don't choose well, or whatever you have, whether you have a refrigerator, please talk to a neighbor who has it. Find a way of keeping it. Or otherwise, adhere to other oral medication that could substitute that drug that need to be stored in a temperature that is lower than the room temperature. That's my candidate advice.
This is a serious one because I know that, especially for children, most of those drugs that are mixed with water, the advice that you put it, as a matter of fact, sometimes they give you the number of days within which it must have
must
been
be
used.
used.
Yes. So many times, you see the color changing, and it makes sense that sometimes this is why the drugs don't work, and we find ourselves as mothers going back to the hospital with that child because we're not
Same
satisfied,
condition, yeah.
yes, with the results of that medicine. So that means we really need the refrigeration. So we cannot even use randa. We cannot put water in a clay pot. I'm just thinking of ways in which one could use.
If the temperature around Randa locally is cool enough, you can. But please adhere to that instruction that is said not later than 2 weeks after use or preparing. Please, once it's time, discard it.
Okay.
Because this drug you see, they are actually gotten from different sources, from animals, from plants, from roots, from leaves. That's what differentiates the physician from a herbalist. The herbalist give you drug unquantified. There's what we call therapeutic index. There's a therapeutic dose, a quantity that once you take that, we expect a little change that will improve your life and not to kill you. Now, when you take those drugs with the quantity prescribed, at a certain time it may expire. Then it will give you the desired effect. But if you take more than, or after storage, or it has expired and you keep taking, it doesn't longer serve the therapeutic purpose. Some drugs, when they expired, they are no longer therapeutic but poisonous. They could actually cause some other undesired effect. So drugs, they have a narrow margin with poisons. When you don't take it at a prescribed drug, you may take something harmful for yourself. So if it expires, please discard it. Get another one or see your doctor for the next line of action.
Okay, so quickly, doctor, still on the matter of children and reconstitution.
Yes, ma'am.
There's a powder
Yes,
in the
ma'am.
bottle, and many times we have a marker that shows you, okay, 300 mils or whatever, this is where the water should get to.
Yes.
So sometimes you put the water up to that place. By the time you shake the water with the powder, and the water settles, you find that the water has gone below the level of the marker. Are you supposed to top it up, or are you just okay?
You're okay. The powder, when you're adding your water up to that mark, there is powder down, water up. As you're mixing, as you're putting in your water, dilution is already taking place. When you finish shaking, air comes up above the water and gives room for mixture. Please, that is the desired volume.
So don't top it up.
Don't.
I have many times topped it up. Lord have
I can
mercy.
see that in your eyes already.
I have so many times I said, well, this is the marker. This is the place where they said the water should reach. So when I finish shaking and I see that the water has gone down, I just feel I should top it up to that place so that I'm not overdosing the
Remember
child.
that when you are adding that water, there is powder down, water coming in, and the level you stop. Let me ask you a science question there. Do you feel like at that level that the water stopped, the marked point, do you feel that there is nothing up again? Is there something up above the water? Or
Apart from the bubbles,
Right.
apart from the air, those
Good,
bubbles.
yeah, because in science we believe there is no vacuum. So by the time you close the cover, you shake them, more bubbles comes up. The water and the powder mix together. They are now homogeneous liquid. They are mixed together. You expect air to still go up.
Anyway, don't stop it up. That's what you're saying. Dr. Abraki said, don't stop up. Mothers,
Please
don't
put it
stop.
to the desired mark.
Just put it
Because
to the desired mark.
while you're doing that, please, there is also need to be careful, because unnecessary opening and closing. Some of us have dirty hands. Some of us have a lot of things in front of us. You touch here and there. The reason for boiling that water, please, is to make sure it is clean and healthy for taking. You will not use a dirty thing to collect that water, put it in, cover, remove, open, try to top up water, get another cold water to add to it. All those preparations are very unnecessary. Once you put in the water desired to the marked point, please cover it, shake it. When you shake and it's really mixed, you can now open just to administer and give. And we always advise you prepare another hot water available. By the time you finish giving, it's good to deepen the cover into that hot water to make sure it is clean. Or if you're using a spoon, when you finish, put it back into a hot water to make sure it is clean for the next administration. Everything you have to use to give that drug should be kept clean. If you cover it without cleaning it up or without washing it with warm water, those other particles hanging outside are not the same drug as the one inside the cover. Inside the container. They are not protected, flies, dust around it, and when you're taking, it may not be clean. So there is need to be very hygienic when giving your children drugs. Their bodies are fragile. Nature made it in such a way that they can recover fast and they can die easily. So just make sure that you're on the side that is positive.
Indeed, they can recover fast and at the same time they can die easily. We need to be careful. All right, we'll go on a quick commercial break, and when we get back, the lines will be open because we have Dr. Abrak up until 7:45 only, and then after then we'll be having Your Health Today. So the lines will be opened immediately after this. Do stay with us. You're listening to Your Health 360. All right, thank you for staying with us through that commercial break. Still with Dr. Abrak, and we are talking about medications, how to take them, and what not to do. And time for us to get your questions this time around. I'll be checking up on our Facebook page for your questions. But in the meantime, let's go to the phone lines. The numbers are 081 40,000 989. Once again, that's 081 40,000 989. Then we have 070 87 800 989. That second number once again is 070 87 800 989. Let's go take your calls. Hello.
Hello. Good evening.
Good evening. If you're going to make your call, please step away from the radio so that you don't we don't have this.
I've done that actually.
Okay, so go ahead quickly.
Good evening, doctor.
Yeah, good evening.
Please, my name is Adam from Malali.
Okay, sir.
Please, I want to confirm, doctor. Sometimes when I travel, I used to buy drugs, maybe abroad or in Nigerian here. I'll keep it in my drawer.
Okay, sir.
Like last 2 years, I traveled and I bought some drugs from Saudi.
Okay, sir.
So I realized the drugs are supposed to expire 2022. But I don't have freeze, I don't have any storage. I just kept them in my wardrobe. Is it safe for me to keep?
Okay. Can I attend to that question?
Is that the only question you have?
Yes, that's the only question. What about, because me, I like buying drugs and keep at home.
Okay.
Okay.
Drugs I usually buy, like now I have a lot of drugs at home, but I'll make sure I check the expiring date.
Okay.
But the only thing I do, I just keep them in my bedside or wardrobe.
Okay. All right.
So
Doctor.
there are drugs that you can store at room temperature and they have no problem. But some of the drugs have peculiar instructions. Keep in a refrigerator or store below 20 degrees or store at 6 degrees. If those are the kind of drugs you buy and you don't keep them appropriately, be sure that by now they have expired, even if the expiry date it's 2022. I will not say they have expired, but they are invalid. They have lost their use. So when you get a drug, read the instruction. If there's no instruction paper attached to it, ask the pharmacist, how do I store them? If there are peculiar instructions, please adhere. When you breach the instruction, get new drugs, please.
Okay. All right. Still taking.
Okay.
All right. I hope you're satisfied.
Yeah, I am.
Okay. So check them and be sure that you're not taking something invalid. All right. Still taking your calls this evening. I'd like to ride on the back of that question that he asked,
Okay,
and talk about people, what about when you carry your drugs around with you? Like you want to take your drugs around 12 and you're leaving the house. And so you just put it inside your bag or you put it inside your pocket. Now we all know what our weather is like. Our weather is, quite hot and humid. Is it okay? Would that still be okay? Or is there a special way that we need to carry our drugs around with us when we need to take it and we're not going to be at home at that time?
Okay, I think I've interacted with many patients about carrying their drugs around. Especially for diabetic patients, you can see them carrying their insulin alongside with ice packs. It is because their drug needs a very low temperature for its storage. Like those other drugs that could withstand 30 degrees, 35 degrees, 38 degrees, you can carry them around. But you can package them, put them in the bag and keep them, I think, at the bottom of the bag so that even with the exposure to heat, they won't be badly damaged. There is a difference with you passing through heat and you standing through heat. Passing through heat because it was just exposed briefly. But some of them are left in the car, the heat of the sun, all through getting heat and heat over time. You may not really have the same efficacy like if it was to be stored in the room temperature. So those drugs have their instructions stored at so temperature. If there are no labels, seek instruction from those producing them. But for many others whom we have interacted about how to carry drugs, if it is something that needs temperature regulation, especially cool or lower temperature, most of them carry them with ice packs, and they know how long an ice pack lasts them, and they know the quantity they can carry along with this ice pack today.
Okay.
Yes.
All right.
So if your drug have an instruction on how to carry, please get the appropriate carrier. Some of them even carry a flask with an ice pack inside, the way we carry our vaccines around. It can last you the whole day being cold. So if your drug don't have a guide, you can always seek, for one, especially a drug you'll be taking for a lifetime. At interval of times, if you take the wrong drug, a lot of things are going wrong in your body and you'll be feeling you're taking the drug, yet it is now invalid. So seek regulations or seek instructions from the pamphlets you get those drugs or from the pharmacist giving you. Over-the-counter drugs may withstand temperature that is 38 degrees. When it is 40 degree or even you, how will you tolerate such degrees, let alone your drug? It may still be invalid. So seek counsel from where you get your drugs from.
All right. Dr. Abrak, while we're waiting for calls, I see Mubarak, Jibril Malam Himma, thank you so much. We're also with you. And then, of course, there's Kojo Saba, who is just saying thank you to you. All right. Thank you so much, Kojo. We're glad that you're listening. Now, Doctor, still talking and looking for a way around this refrigeration matter. Would it be okay to put those kind of drugs in a cooler, for instance, and put, when you were talking about ice packs, it just, that idea just came to my mind that could one, these people who don't have refrigerators, could people like that get ice, buy ice and put it in, like a cooler like thing and, replenish or refresh every time it melts? Would that work?
It can, but life itself doesn't treat everyone equal. You see someone who is not well to do with a very big disease that really needs such kind of medication. For how long will you buy the ice packs? If you can't afford a fridge, how long? And there are instances where you will look for the ice pack you won't get even if you have the money. And it will make your expensive drug to get expired. Life is really unequal in its treatment, but in all sense, learn to do the right thing. The right thing is to keep it cool. If you can afford the ice pack regularly and you have a source, that's another way. But there are days that your source could have a light problem, could have a refrigerator problem, could have a carriage problem. You could carry the ice pack before reaching it has melted or something happened, it fell on the floor. So many things could go wrong. And one day in between without those drugs can actually made it to be invalid. So it's good to have a consistent system. If it fails, it's good to also get a new one. Even though it's expensive, most of those drugs are expensive, like insulin. It's expensive for a common man. And you find out many people are on it at the moment.
Okay. All right. So, I don't see calls. I hope it's not because there's a problem with the lines. I hope it's because I'm asking the right questions. Once again, the lines are open. The numbers are 081 and 07087800989. Let's quickly talk about some other medications and some of the interactions that people might see and what to do about it. For instance, Dr. Abrak, if one is on antihypertensive drugs and one finds out that it's affecting his or her libido, is this just a natural part of it, or do you report back all these things that you seem to notice in your taking of those drugs? Or is it just a natural part of the taking of antihypertensives, and so therefore, I mean, it's a case of priority. What's your priority?
Now, relating antihypertensive drug with a change in libido, a lot of times it's not associated with the drug. It's a pathway of that disease condition. So many with diabetes, hypertension, they are actually with that libido, erection problem, or maybe loss of interest in sexual intercourse. Yeah, because okay, let me just give in a little brief those hypertensive issue where your heart works extra mile to make sure that it gives blood to every part of the body, and most of the time the fingers, the hands and the legs, they are far from the chest. Imagine the heart have to pump with so much pressure to make sure blood reaches to all those ends. Any change, any of those little parts that is devoid of blood, it sends a signal to the heart to increase. It increase in its beats and it increase in its pressure. So constantly there could be insufficiency in those areas, including the glands of intercourse. So disease condition can happen to any part of the body as a result of hypertension.
So it's not the drugs.
Most of the time it's not. Because most people with hypertension, they just go to the hospital for headache, and others they discover they're hypertensive. Let me bring a scenario. Let me just bring a layman scenario. Like, assuming I am 60 years old, could I say that since I was born, my heart was working without stopping? Because in my sleep, when I'm awake, when I'm driving, when I'm eating, when I'm reading, my heart keeps pumping blood. If I'm 60, that means my heart has been working for the past 60 years without resting. So do you see those people who goes to gym, do exercise for 6 months, you find them looking bold and big. And if you don't, your muscle could get wasted. If this heart work for such a long time, some of the time the heart become muscular and thick. It doesn't expand freely, neither does it squeeze enough blood. If it normally squeeze 1, 2 for all the body parts to get blood, now it has to squeeze 5, 6 to give the same amount. Then you realize that the heart is working hard to compensate. Are you getting me? So those times where there are insufficiencies, sending back signals, and then the heart keep trying hard, a lot of tissues get damaged, a lot of tissues become regress, they become reduced in function because they are not getting sufficient. That disease condition had been on until one day something will take you to the hospital to find out how this and that, and they will now check your signs and say, you have a high BP. Let's check tomorrow again. Let's do this test. Let's do the other. Then you realize that there are already changes going around your heart. If such things are found, because most hypertensions are diagnosed coincidentally, except you come with some key signs, and for those key signs to have shown, the heart must have tried enough to compensate and it's failing, then you realize you have to present with those symptoms of hypertension. Otherwise, there is a lot that has gone wrong, and at that time, it's not really the drug. Now, the drug we do take, because I do see most people, they say, when I take today, my BP is normal, I don't need to take, I've recovered. No. I used to give example to my patient that are around me. I would tell them, okay, let's assume we fasted for 2 days, and today you ate food, and I didn't. And I ask you to take this table from point A to point B. Can you do that? She will say yes, or he will say yes, he can. What about me who had been fasting for 2 days and have not eaten? Can you not take the table to the same point? Say, Some will say no, some will say yes. I say, but if I would take, will it be easy as you? They will say no. I will take with a struggle because I haven't eaten. You may take it with ease. Now, most of those drugs are to help the heart to function effectively. If you don't take those drugs to support the heart do its work, it may function, but with a lot of stress, and it will undergo those changes we're talking about, the heart muscles. And you realize that the heart will keep failing. That's why sometimes you wake up and someone is gone, uneventful. The heart gives up. That's tried. Those heart failures, they come after it has worked and could no longer compensate. So most of the time, there is a lot that have gone wrong than the drugs. Those drugs, they have their interactions, and we're careful about them. But most of the time, hypertensions have thousands of complications. And you cannot predict until you manifest with one that is related to it. You can't predict where and where will fail first.
So quickly, we've run out of time, but
Yes,
when we talk about people who, especially those who are on medication, for the rest of their lives, there are times when they get to and they skip their medication. There was something you touched on, and I just thought it would be nice to say it in black and white. Is it good or even safe to skip medication? Say you take today and you don't take tomorrow. Some people, it's out of economic reasons. They want to, stretch out the drugs long enough for them to, before they go and have a refill. So skipping your drugs, taking it every other day when you should take it every day.
Yeah, skipping of drugs when it's not prescribed to skip is not advisable. Because at the time your blood pressure is checked, or your sugar is checked, or this condition is diagnosed, there is a need for it to get daily medication. If there is need for skipping or reduction, your doctor will advise you. Let me just give an example. Today I eat tuwo, a full plate, and it's over. I'm satisfied. Tomorrow I may eat the same tuwo, but 2 spoons, I'm okay. Another day I will need rice. That's why it's good to see your doctor constantly, because at interval of time, when your BP begins to go down, your doctor could change your drug to a more or less stronger one, or to a smaller dose, or to give you a higher one, depending. Once you're hypertensive or diabetics, you're a friend to your doctor at all times. Just the way you regulate what you eat each day. Today you eat the same rice but different quantity. Tomorrow, when he sees your BP had been on this trend, he will say, okay, let's take it back to 5 milligrams instead of 10. Consistently, when your BP begins to go up, it's just to keep regulating, supporting the heart as it deems fit. Because I'm not with you at home, I wouldn't know the state of the heart at that time. So it's good to keep seeing your doctor when you feel those changes. If there is need, doctor, I don't have money. He may give you a drug that have a longer, there's what we call half-life. Half-life of a drug, they varies. There's a drug you take and it ends, the strength of that drug is completely used at 10 hours, some 24 hours, some even 48 hours. So he may prescribe a drug for you that have a longer half-life of 48 hours. You take it once and it serves you longer for 48 hours than skipping when you know you actually need it every 24 hours. So the doctor could actually give you what you need based on the state of your condition. It's good to see them all the time.
See your doctor, tell him exactly what is going on, even the economics of your pocket, so that he will know the kind of drug to prescribe. Dr. Abrak, it's been a pleasure. Thank you so much. You've been here with us since last week, and we'd like to really thank you for clarifying, medications, their interactions, what we should do and what we shouldn't do when taking drugs. I hope that after listening to you, none of us will go about taking our medications with juice or putting them inside tuwo or alcohol for that matter. Right. Thank you so much, Dr. Abrak.
Thank you very much too for the time.
Coming up next is Your Health Today. Stay with us.